Hey, and welcome to Food Feels and Banana Peels. I'm your host, Laura Pfeiffer. Thanks for joining me. This podcast is all about providing a different perspective on health and disease for you to consider. It's about inspiring you to take control of your own health, advocate for yourself, and be curious about how you can support yourself holistically and naturally so you can live each day happier and healthier than the last. Hey everybody, welcome to Food Feels and Banana Peels today. I'm Laura, your host, and I'm so thrilled to be with an amazing friend of mine who has been traveling the world for an extensive period of time and finally back on Canadian soil. Brigitta Ziemba is a naturopathic doctor, and I'm so grateful to her for being here today and showing up because she is going to blow our minds with alternative perspectives on health. Welcome, Brigitta. Thanks so much for being here.
Oh, I'm super excited to be here. And I love the name of your show. Can I just start with saying that?
Thank you. Thank you. I wanted to be something fun, right?
It's amazing.
These conversations are not always fun. They're not always uplifting. When we really begin to look at the root causes of disease and the journey that it takes to find health, it's pretty deep.
It is. It can be. And usually is.
Exactly. So lightening things up, at least in the name, was absolutely my goal.
Brilliant.
So Brigitta, tell us a little bit about yourself to introduce you to our listeners who haven't met you before.
Absolutely. So I'm trained as a naturopathic doctor. I can't legally call myself a naturopathic doctor here in Ontario, but I was also a paramedic for 10 years. And my focus really is in brain health, neurological health, trauma recovery, and chronic pain management. So that's really my jam and what my passion is and my focus is. So it's beautiful to be here and to have the opportunity to share both my experiences as a paramedic, like transitioning to naturopathic medicine, because a lot of people are like, wow, that's a pretty drastic, transition. So it's always beautiful to be able to bring different perspectives and to be able to talk about this stuff, because I think people don't necessarily know what to expect. And a big piece of my work too is cranio-sacral therapy and energy work. So it's kind of come full circle in ways that I did not expect it to, but it's all beautiful.
And you are beautiful and amazing. And I'm so excited for you to share your alternative perspectives to us, because you not only work, with the physical body, you're also very connected with the mental, emotional, and spiritual aspects of our bodies and our physical health. And that is exactly why I wanted to talk to you today. You are somebody who looks at all of these different bodies. And we've been talking on Food Feels and Banana Peels, how we are not just this physical being. We have this mental, emotional, spiritual aspect to us. And the beauty of you as a practitioner is you provide all of these medicines to your clients. And I've been fortunate to be on the receiving end and to have worked with you. And it has been an amazing journey.
Thank you.
So Brigitta, I want to ask you first of all a little bit about your naturopathic training. Could you tell people what it involves to become a naturopathic doctor? A lot of people know that, it takes about 10 years to become a Western medicine doc, and you do a residency. Tell us a little bit about the naturopathic field, and because I know that is an extensive journey as well.
It is, yeah. So it does require an undergrad degree. And much like medical school, really where it differs, our first 2 years are very similar. So the anatomy, physiology, immunology, microbiology, all those things are pretty much foundational. So when we look at, how we're tested and write our board exams, we basically use the same thing, the same textbook that medical doctors use for our first set of exams. So we do get like that same foundation, but where our training really differs is we're trained more as primary caregivers, right? So we're not going to be going into trauma medicine. We're not going to become like specialists in whatever it is, right? So really we're trained as primary care providers. So really good foundation about everything whole health. We also, of course, get all the additional training of botanical medicine. Like we do the pharmacology. We also have manual therapies that we incorporate, the traditional Chinese medicine, homeopathy. We call them naturopathic adjustments, not chiropractic adjustments. So, and then of course, a lot of us will do additional training on the side, whatever that looks like as well. So it's very extensive. And then really the last 2 years, it's more geared towards more of our medicines, if you will, what's been integrated from our forefathers, right? So everything from like mostly, I would say, European botanical medicine is a big piece of it. Homeopathy, depending on the school you go to, Ayurveda might be pulled into that. It really depends who founded the schools. But a lot of our practices, like it's very much holistic. We still understand and know when to refer, when to use functional medicine testing, lab work, requisition, all of those pieces. And then we have a full year of internship where we bring it all together. So it's equivalent to basically like a residency where we're practicing in a student clinic overseen by supervisors as well. So there's thousands of hours of hands-on patient practice. We sit board exams to be regulated in the province. So that really depends on the province, state, country, much like medical doctors, nurses, different practitioners. It all kind of depends what the regulation is, individual places. But the training is quite extensive. Like, I did my undergrad, I went to college as a paramedic, and then I went back to school for naturopathic medicine. And like, man, it's a lot. Like, it's grueling. So, it's 4 years of school. I did mine in 6 because I was still working as a paramedic. So I spread my training out a little bit longer. I think that's a good overall. We have thousands of hours of, different trainings, hands-on practical experience. So I think also the important piece is to understand that naturopathic doctors and naturopaths are very different. So depending where you are, most places you can call yourself a naturopath. It may not be a regulated title. So someone might take a weekend course in, and not to like slight anybody, but they might do like a reflexology or like a weekend course in something, and they can call themselves a naturopath, where a naturopathic doctor has had extensive medical training as well, board exams, they're regulated, all those things. So there's a very big difference between that, and actually in Ontario, you can't even use the term naturopath because it's regulated. So, or it's title protected, I should say. So it really just depends. And in places where the profession is not regulated, it's up to the person, the consumer, the patient, to really do that research of, what does that training look like? And not that there's anything, negative. It's just really understanding like what is their scope and what is their
Yes.
capability. And there's some really amazing practitioners that have done extensive training in all kinds of things, and they're very well versed as well, right? And they just don't have the title, or they've gone a different route, and that's totally amazing too.
Right. So just to kind of recap, because that's lots
Mhm.
of information and that's really
Mhm.
important information, Brigitta. Thank you for sharing, because
You're welcome.
the natural field is a very interesting field when it comes to regulating and not regulating, and it can be very almost like greenwashing. Like, you can use certain names and certain titles, but it doesn't
Yeah.
necessarily mean, because it's not under the same kind of regulatory bodies as say the medical profession, it doesn't necessarily mean that you're actually receiving maybe the type of care or
Mhm.
the level of care, if you will, that maybe we otherwise would have maybe expected or thought from someone with such and such a title. It's the same with, obviously, with natural health products, and we
Right.
probably will end up speaking about that at some point too. But so to recap, 8 years is what you did. 4 years
Um,
undergrad, and then your 4 years, right? Essentially,
right.
and then you
To,
did it.
to go through the naturopathic, and then I did 2 years of paramedic college and
Right,
tons of
right,
additional training on top of that. But yeah,
right.
spent a lot
So
of my life in school, basically.
you have, and you
Yeah.
bring these two amazingly different avenues, in paramedic and trauma, and the Western medical system is where you spent a ton of time, and
Yeah.
then you've taken, and now you have this amazing extensive training with natural medicine. So
Mhm.
you bring some very, very unique perspective, experience, and views, because you are versed in both. which is why I love chatting with you. And I'm so excited to continue further because you just are a wealth of knowledge. Thank you for clarifying about a naturopathic doctor, because I think that is very, very important for people to understand. And if they can pull one thing out of our conversation already, it's to do your homework and your research about who you are going to see.
100%.
I'd like to ask you a little bit about your philosophy on health and disease, Brigitta, because I find that this changes from practitioner to practitioner. And I definitely find that Western medicine versus naturopathic medicine have very, very different views. So let's talk about your perception of health and disease, however you want to put that together or individually.
Oh, that's such like a broad open platform. Um, okay, so I think when we look at conventional medicine, right, like from a paramedic perspective, like that conventional model, really we look at health as an absence of disease, right? So it's like if you're not sick or dying, then like you're fine, right? So, one of my mentors, she talks about the salutogenic model, and she talks about how you don't go to your family doctor and say like, "Hey, I feel like a 7 out of 10 and I want to feel like a 10 out of 10. Can you help me?" And they look at you like, "What do you want me to do?" Right?
Seven's great. Seven's
Seven's
perfect.
great, like
Yeah.
it's fine.
It's better than the
So
four over there.
But it really is about the framework and the lens and the reference points that we view health
Mhm.
from
Mhm.
and disease from, right? And those shift. So I think that's a big takeaway is like depending who views it, what their training is, what their knowledge base is, they're going to look at it differently. And so when we look at it from a naturopathic medicine, really we talk a lot about health is not just the absence of disease. It is all of like the physical, mental, emotional, spiritual well-being of a person. And when one of those things are not in alignment, it throws we can talk about the energetic fields, or we can talk about the balance of the body, right? So it's like physically you might be doing the right things, but if there's all this emotional stress, trauma, whatever it is, it's still going to tip the body. And really we can look at the hormonal system, we can look at energetics, we can look at all those pieces. It's still the body's ability to heal and repair and be in a state of health is really still going to be limited. So, and to me, my practice has really shifted, having moved and been around the world and coming back here. And really, my scope is a little bit more limited here. And I'm doing a lot more cranio-sacral work and trauma work. And it's super fascinating to see the physical shifts that happen when we address the mental, emotional, also the physical imbalances of the body, but really working in with the nervous system and releasing stored trauma. Because really, at the crux of it all, when we're looking at the sympathetic nervous system, which is a fight or flight response, and the parasympathetic, the rest, digest, repair, if we're constantly in that sympathetic, we can't be healing. So if the nervous system is fundamentally not in that parasympathetic state, we can give you all the supplements we want. We can do all the things we want. It might work for a little bit, but then what we interestingly see is like after a couple months or whatever that looks like, they kind of go backwards. And you're like, okay, there's that missing piece. So it's like that often it's broken up. It's like that dis-ease that's in the
Mhm.
body. And it's like, where is the root of that? And really,
Mhm.
when we look at naturopathic medicine, we always speak about like the root cause.
Yes.
And so that root cause might have many, many layers. And so, yes, we can look at the physical, but then we also have to get into the mental, emotional, spiritual, psychological, even, right? Like whatever that looks like. And that's different for everybody. And how we address that and who's on the care team might vary as well, right? So, I think my philosophy is just being very open to whoever needs to be on the care team. I think that's one thing that has come up is, when I was a paramedic and I didn't tell very many people I was in school for naturopathic medicine initially because they're like, Brigitta's gone off the deep end, right? But it's not one or the other. And sometimes we need to use medication to help get us to where we want to be, right? So I'm not anti anything. I think it really, whoever resonates with you and is part of your team, like amazing. And that might shift and evolve as your healing journey shifts and evolves too. And that being said, too, I think the beauty of having such a diverse toolbox is that you can kind of see, okay, where are you on your journey and how can I support you? And where do we pull people in that will also support you on that journey? So it's just really nice to have a broad perspective of health and wellness and healing that isn't, you know, such a narrow lens.
Yeah,
So I don't know if that answered your question, but that's a very
no, it's
broad
great because it gives me
way.
lots to work with. Whether
Mhm.
we haven't actually talked about disease as
Yeah.
much, but this health aspect is so important. And you talked about a collaborative approach, right?
Hmm.
And it's interesting because when I was talking with an MD the other day, we talked about a collaborative approach to help support because he understands that there is a huge mental component. He understanding that there is more than just this physical body that we're working with, right? So this collaborative approach of bringing different practitioners together based on their own levels of expertise, right? Working with, say, like a nutritional practitioner like myself for
Hmm.
food, right? Yourself for the natural medicines, the supplementation, the herbal supports, all of those kinds of things, right? An MD for whatever the acute portion of the disease is. There's ways that, like you just said, that we can work collaboratively that will help support each patient on an individual basis. And that's what I love about natural medicines is that we see each person as an individual. And that is where, for me, in my own experience with disease, I felt very labeled, like you are the disease that you are.
Right.
That's who you are. There was never any form of like, hey, there's an emotional, mental being in this really sick body. But all we're doing is we are taking and we are going to do whatever the physical treatment is here, whether it's, poking and prodding and blood work and feeding you pills and pills and pills and these kinds of things, right? And it's like, hey, hang on a second, I'm so messed up in my mind right now. I'm so fearful and scared. My emotions are all out of whack, but none of that was addressed for me. And I feel that there are others that have that experience as well. So the naturopathic support that came in following my acute disease, I really attribute that to what helped me to regain health and live healthy beyond that disease. I feel without all of that support, I don't feel that I would be, where I am today.
It's
So
amazing. And I love that you share your story so openly too, because I know it's been such a journey for you as well, right? So
it
thank you.
has, it has.
Yeah.
Oh, and it's my pleasure. I mean, that was what this was all about, opening up, right? This is about opening up because you and I know that as healers and on our path, it's also part of our, not, I don't want to say it's not a job, but it's our mission, if you will, to share our experiences, right? And so
Really.
that we can help alleviate others' suffering because nobody likes to suffer and it's terrible to suffer. And you and I were actually talking about suffering earlier before we actually started recording, right?
Yeah.
Suffering and the fact that we have tools and we have tool belts full of tools to mitigate the suffering. And there are
Mhm.
so many people out there who don't have those tools. And I have so much empathy and compassion for them because had I had the experiences that I had without the tools that I had, I have no idea where I would be today.
Yeah.
So yes, the naturopathic, obviously I align completely with
Yeah.
that. I'm a little biased, but on the other hand, I also pharmaceutical and like Western supports when
Hmm.
necessary. So that I believe has been
100%.
a big part of my journey is understanding that there is a need for both. We
Yeah.
need Western medicine. We need it, right? It is so important for acute situations. And we're just seeing so many chronic situations now being treated with those supports that were kind
Hmm.
of designed to be something more temporary, something for the
Yeah.
acute phase of treatment. And this is where I see it being so important that we begin to all advocate for our own health and become more informed so that
Hmm.
we know, okay, like I was on antidepressants for years
Yeah.
and years, and I didn't have the tools to get off of them. So they were a support for me. But
Hmm.
antidepressants didn't teach me how to navigate the moods and emotions and all of those things. It was the shamanic work and the angel work and all of these different avenues, the yoga, the meditation. That's what helped me learn how to navigate that anxiety, depression that I suffered from. Had I not had those other tools, I would probably just continue to take medication, and then they continue to up your medication and up your medication and mess with your system, right? I mean, eventually you're not really even producing serotonin. You're not even producing that neurotransmitter.
Yeah. And I think it's, you speak so beautifully to the system, right? And I'm always very mindful, like when I speak of it, because I have often dubbed it the sick care system, but really that's like the focus, right? And when we look at it, it's like to prevent death and dying. That's what the system is set up for. And the system is based on, you touched on this earlier about individualized medicine, right? Western medicine, or like, I don't even like it calling it Western medicine, but really, the conventional system is really a protocol-based system. You come in, you present with these symptoms, we give you this medication, right? This is a first line drug. This is a second one. If this doesn't work, we move to this. We
You're
try
in this
things, right?
box. We put you in
You're
this
in this
box,
box.
and then based on that box, we give you this.
Right. And yes, there might be a time and a place to palliate or to basically help, like in acute situations, right? When someone is acutely manic or depressive or whatever the situation is, yes, there needs to be medication. There also needs to be those tools because, like you said, it's like if you never, at the end of the day, if we never actually address what's causing this disease, then you're you're just band-aiding it, right? So then
Exactly.
it's like you can still do the medication and you can also do this.
Mm-hmm.
Or it's like, we spoke to a lot of our colleagues about this, is like they're waiting to see a trauma therapist, right? To be diagnosed with PTSD or to work through with PTSD. And it's like that wait list can be months on end. In the meantime, what are you doing?
Mm-hmm.
Like, are you just a sitting duck waiting, or are you taking responsibility for your own health, like you said,
Mm-hmm.
and trying different things? Because it might sound woo-woo and it might sound out of the box, but you know what? That's what might actually work for you.
Mm-hmm.
And
Mm-hmm.
finding a practitioner you align with. And I think the other big issue I find, especially in Canada, is this belief of like free healthcare. And the healthcare system should just take care of you.
Yeah. Mm-hmm.
Right? Yes, it will
Mm-hmm.
take care of you if there's an emergency, if there's
Yes.
like a major issue and you need surgery or whatever it is. But our health is our own responsibility,
Mm-hmm.
right? The government doesn't give you money for food, and that's a big part of our foundational health,
Mm-hmm.
right? It's like the government doesn't give you money to go for a walk or to go get some sunshine, right? Or fresh air, like all those things that are medicines,
Mm-hmm.
right? Like we shouldn't have to be told, like, these are helpful for us. So it's like sometimes you need to invest in your own health and
Yes.
wellness, right? And I think that's a big mindset shift for a lot of people, is like finding those people and thinking outside of the box, And I
Mm-hmm.
realize everyone is in a different space. Like for some people, even like a massage or a chiropractor might be like a really big step. And then for some people, it's like, doing shamanic work or
Mm-hmm.
cranial-sacral work or energy work or Reiki, whatever it is, that might be their big leap.
Mm-hmm.
But you don't know it unless you try.
Agreed.
Right. And so I think it's like being open to different ways of healing
Mm-hmm.
is probably the smartest thing you can do, right? Because it's not just a pill for an ill. There's so many different pieces to it and there's so many different people that can help you, but you have to, one of my good friends, she's like, you have to go on a lot of first dates with practitioners and see like, is this the right modality and is this the right therapist? Because
Mm-hmm.
that could also be a different combination. It might be the right modality, but the wrong therapist, or the
Mm-hmm.
right therapist, right? So it's like, it's all
Yes.
those things. So it's like, go on a lot of first dates, like, and just try things out.
I like that analogy. And yeah, I think it's so important that there is kind of overall a shift in perspective for many people about health and
Mhm.
disease. And unfortunately, so many people are finding that shift once they've progressed into such a severe disease state that now it becomes almost like you're treading to stay above water.
Yeah.
Whereas there are often signs and symptoms that are there for days, weeks, months, even years
Years.
in a lot of these chronic conditions, right?
Yeah.
Years that we've ignored. I think it also comes back to people needing to begin to be more aware of themselves and their physical bodies. We are taught to be aware of our external surroundings. In our society, we're taught like this is right and this is wrong and this is the way you do this and and this is the way you do that and there needs to be a shift where people go, hang on a second. There's a lot of different guidelines that are here, but I get to set my own boundaries and I get to decide overall, I'm the one who has to live this life. And so, am I living happy and healthy? Am I feeling energized and full of vitality and living with purpose and all of those things, right? And so this is where the allopathic medicine would be like, yeah, you're a 7, you're fine. Sorry you're not feeling purposeful and sorry you don't have a ton of energy, but your stats say that you're fine, you're in that normal range. And this is where people who are aware of their bodies and themselves can come to somebody like you and natural practitioners and say, hey, listen, I know that we've had this blood work run and whatnot, and you guys run blood work as well.
Yeah.
And everything is coming back normal, but I know things aren't normal, right? And this is where you begin to come in and you begin to consider the entire organism, the entire human, as opposed to these small systems being looked at not interconnectedly, but individually. I talked to a girl who ended up seeing like an endocrinologist and somebody for dermatology, somebody for this, that, 10 different ones. And she said to them, is anybody talking to anybody here? Like, do you see that I am like, there's got to be some kind of root.
Yeah. And that's just it. Like blood goes everywhere, right? So it connects like all the systems. And you touch on a very important point too that I think it's worthwhile mentioning is people will go to their family doctors. They're like, I don't feel good. They'll run some labs and they'll be like, well, your labs are normal. So let's break that down potentially on what normal is, right? So lab values are set based on X number of people that go to that lab and they use that as a reference range. So if everyone is depleted in something, now that reference range becomes the average of those depleted people. Or it has a very, very like big range. So for example, I like to talk about ferritin all the time because most women go to their family doctor and they're like, I'm tired, like I don't have energy, like I feel like I could sleep all the time, like all the things, like they're pale, and then their doctor runs all the things and they're like, oh, it's fine. But the reference range for ferritin can run, depending on the lab, once again, it'll vary, but it can run from like 11 to like 272. You're not going to feel optimal at 11, but you're not anemic. So your doctor is going to go, well, I can't do anything because in my protocol based, checkbox, I can't give you anything because you're not technically deficient. Are you suboptimal? Absolutely. Like we want that number to be, closer to 100 for you to be feeling good. So if you're taking along at 12, you're not anemic and you're not deficient and your doctor is going to say you're normal, but you're far away from being optimal.
Right.
And I think that's where really the nuances and how we interpret even lab work, right? Because it's what we look like, how we look at it from a naturopathic perspective is like, how can we optimize where you're at? And where are you creeping towards that like suboptimal stage? And probably why you're feeling like garbage. But the lens, once again, it comes back to the lens, like the medical doctors, because they're very protocol based and that's how they're trained, right? It's not their own fault. It's the way the whole system is set up. It's like you treat deficiency or you address deficiency, you address disease, but you don't do the preventative medicine. So it's like, this is where we look at the preventative side. Well, I would like you to not be getting iron transfusions. So like, let's deal with that now,
Yeah.
right? It's a very different lens. And this is where even if you have your blood work, a naturopathic doctor can look at it and say like, okay, these are the things that are kind of out of whack. Let's get you feeling optimal and how can we prevent further disease and suffering, right? And really, you spoke about the vessel and like how we feel in our vessel. Like we have one body and it's like we want to be thriving in it. So how do we do that? And how do we feel good? And then when you feel good, then you're like, okay, now I can follow my purpose and my passion and my drive and do the things that I want to do, right? It becomes this whole cycle of just when you feel better physically, like then it's like the pieces will also fit in and they loop back to each other,
Yes.
right? But yeah, there's so many pieces to it. So it's like making sure that people are not suboptimal or deficient in things is a massive like foundational piece.
It's like talking to people and people say they're okay. Who wants to
Right.
live okay? Like, okay? That's so blah, right? I mean, we want to live with health and vitality, and I think that we as humans are here to have experiences and experience joy and health and love and all of those things. But
Yeah.
when all of these parts of our being are so out of alignment, it's
Hmm.
very hard to have those, especially on any type of regular basis. We might have
Yeah.
these experience here and this experience there, but we're here to have these experiences and that to be our experience of our time here, right?
Absolutely. And I think the biggest thing is, as you speak about it too, it's like aging, right? Like so many things are just chalked to like you're getting older and you're like,
Yes.
that's not even a thing. Like
Yes.
like
Yes.
how many like 89-year-olds do you see running around playing tennis or like hiking or whatever it is, and they're like out doing most like 20, 30, 40-year-olds, and you're like, it's just not a thing. Like you
Hmm.
can't chalk things
Hmm.
up to just getting older. Like that's not
Right.
an excuse. So it's like, if we take care of ourselves and do the things, it's
Hmm.
like we can live with health span, really. And that's what it is. It's like nobody wants to, I mean, I saw it as a paramedic, right? It's like you see that decline of people where, they've been putting along, and then it's like one medication, two medications, and it's like we're prolonging life, but the quality isn't
Hmm.
there. And really, that's what we want, is we want a good quality of life. Like, and I personally, I'd rather just not wake up one day,
Me
like I
too.
want to have an amazing
Hmm.
quality of life, not
Hmm.
this like downward spiral of like, oh, like I can see the end and all these like health conditions creeping up, right? So that's really the importance of like doing the work earlier in life, because you're setting yourself up for success later.
Agreed. Yeah,
Yeah.
and I think that the beauty of the, alternative healthcare practitioners and seeking those avenues is we teach people to become more aware of themselves, and then
Mhm.
they have the ability to choose what works for them.
Yes.
So not every human on this earth, let's say, shouldn't eat dairy products.
Right.
Okay. But there are many humans on this earth that likely dairy isn't agreeing with them. When we begin to show said humans
Hmm.
what the effects are of the dairy on their system, they become informed and aware and then can make those choices whether or not it's something they would like to continue with. The
Hmm.
psoriasis, the chronic inflammation, the indigestion and
The cystic
constipation,
acne.
and
Yep.
exactly all of
Yep.
those things that happen because oftentimes dairy is the root. Cow's dairy is a big root in disease when we're talking about nutrition. At least we are helping to inform people, and then people get to make those decisions based on
Mhm.
the information they have, not blind following. Okay, I'm going to stop eating this. I'm going to start doing this. I'm going to, it's when you work with a practitioner as an individual, then you be able to begin to build your own tool belt
Mhm.
of what works for you, because we can't say that what works for you and I are anywhere near the same, and the
Yeah.
same with the next person, right? I can tell you my experience and share with you my experience, and these are the tools that I have in my tool belt, and what works for me in order to live healthy, happy, and we also must admit that it changes and it shifts. So we have to
Absolutely.
continually be aware. Oh, hang on a second, something's going on now. Maybe I need to go see somebody, or,
Mhm.
get back onto the right track. In the aging process, like you said, I mean, you hear, oh, you're getting older, so your hormones are all over and you're going to have night sweats, oh, the hair growth and like all these, oh, it's just normal. And it's like, it doesn't have to be normal, you know?
Yeah. And when you were speaking, what dropped in was the word empowerment, right?
Hmm.
The beauty of the work that we do, it's the clients that I will not work with are the ones that come in and say, fix me.
Hmm.
Because this is not handing over your power and saying, give me a pill.
Right.
It's teamwork. It's
Hmm.
like, I have the knowledge, but you are the expert in your body.
Exactly.
So we need to work together to see, because like I can look at all the research, I can have all the clinical experience. That may or may not work in your body
Hmm.
and where you're at or at this time, right? So it really is this dance and this teamwork of like, well, what's going to work for you? What is working for you? How is your body feeling? And like you said, it's like sometimes we know, like, okay, this doesn't work for my body, but I want to have, like, I want to go cheat and I want to have some cheese or whatever it is, if we're using the dairy
Yeah.
example, right? Or whatever it is, it's like, okay, I know that if I do that, this is how I'm going to feel.
Mm-hmm.
It's like I'm okay with that, right?
Right.
But it's that knowledge base of like, okay, this is what happens. Or like I get the joint pain when I have gluten or the brain fog or whatever it is, right?
Mm-hmm.
So it's like just being very aware. And it's not that you don't do it. Like we're still human. Like we all are human. We do the things too,
Yeah,
right?
for
Like we're
sure.
not, there's no such thing as perfect. So it's like but it's really about empowering you so that you have these tools. And my favorites, like I love saying to my clients, I'm like, okay, we're good. Like if you need me, I'm here. And they look at me like,
Mm-hmm.
what do
I
you mean?
know.
Like
Yeah.
they look at you like, what do you, and it's like,
Yeah.
go
Yeah.
do the things, right?
Yeah.
And like we can check up and see how you're doing. And do you need a little bit of extra support? But like our model is not like you keep, or my model isn't you keep coming back to
Mm-hmm.
me and I
Mm-hmm.
keep like, if you need more support, I'm totally here for you. But like, the things, how to do the things, go
Mm-hmm.
do the things, right? And
Yes.
it's like, I'm so happy when I can basically tell someone like, okay, like you're good. We can follow up if you want, like in a year or 6 months, whatever it is. And it's a very different model. It's not keeping people hooked. It's about empowering people and like
Mm-hmm.
sending them on their way because there's so many people for us to help and support that like I can't possibly keep everybody, right? Like, and it's a very different business model too. And I think that's the other piece that a lot of my clients, when I tell them, we only need to do a couple sessions with craniosacral work, and they look at me like, what do you mean? Like I've been going for regular maintenance. I'm like, that shouldn't be a thing.
Yeah.
Like what is the root cause of like why are you maintaining or doing maintenance? Like,
Mm-hmm. Yeah.
right? So
Yeah.
I look at things very, I think even within um yeah, even sometimes the naturopathic world is like I have a little bit of a different lens, even I think with my craniosacral and energy work. It's so, but yeah, it's about empowering people. I think that's really where it's at, and not everybody's ready to be that or be there in that space, right? Because that's a big paradigm shift when people are used to going to someone and they're being told like, hey, you need to take this and do this, and then all of a sudden it's like, whoa, like have to take responsibility
Yeah.
because so many people have unknowingly given their power
Mm-hmm.
away,
Mm-hmm.
right? So start to reclaim that is a big piece.
Yeah, you're absolutely right about that. And it can be very overwhelming to
Hmm.
recognize that when you start to take responsibility for your own health, that you're actually the one who has made many contributions that have landed you in the space that you're in. And
Right.
now it's your job, because we're working toward loving and supporting ourselves individually. And if we don't do that individually, we can't possibly do that for others. When
Right.
we start to do that, we also have to run through all of this is where the mental, emotional, spiritual aspect comes in
Yeah.
because we're forgiving ourselves for getting to whatever point it is in our lives that we're at, right? And we're coming to
Yeah.
terms with some of the emotional traumas and experiences that we've had that have landed us in these situations that have taken us down these avenues. When you begin to really open up this door
Mhm.
to living healthier and happier, it can be a very difficult journey, but I always say it's the most rewarding journey that I've ever taken in my life. And I'm a mom. I love
Yeah.
my kids, and that whole mothering experience is absolutely 100% a gift. But the gift that I'm giving to me keeps
Hmm.
giving because it's giving, not only to me, but to my children, right? And it kind of reverberates outward. So when we begin to
100%.
feed and find balance and health and love within ourselves, it's amazing how our outer world begins to change.
Hmm. It does. And I think the other important piece is just like we're a contributing factor to our like state of disease. The cool thing is we also have the power to contribute to our health, right? So that's where the difference lies too, is like, yes, you are a contributing piece to like what's going on, but you also have the power to radically shift your health.
Right.
And that's the cool thing is like
Hmm.
you're a contributor to both sides of it.
Yes.
And so it's like
Yes.
you get to choose.
Hmm.
And I think it's super empowering to be like, okay, I get to choose my health and wellness and what I do and how I want that to look.
Yes, absolutely
And
agreed.
like you said, like what that ripples out into the world as.
Yeah, when we change the way we look at things, things change,
Mhm.
and everything is a conscious or unconscious choice. And so when we
Yeah.
begin to bring some of the unconscious stuff into our
Mm,
consciousness, then we can be like, okay, actually, I'm not choosing to be diseased today. I'm
yeah,
choosing to go down a different path. Like you said, a more empowering experience.
absolutely.
Okay, so I wanted to ask you, oh man, you and I we can chat, can't we?
We can.
I think this is based on a couple of questions already. Okay, so my next question is, because each client is individual and there are individualistic approaches, what are
Mhm.
the things that you're seeing the most in your practice when clients are coming in? Because there are trends, definite trends in health that you're likely seeing. And what is your approach or the naturopathic way of working with
A great
these?
question. So I would say the last 5, 6 months that I've been back in Canada, I've been doing mainly craniosacral work. So craniosacral work comes from osteopathic medicine. So we work in with the physiologic anatomical structures, but a big piece of it is the nervous system. So working in with the central nervous system, so the brain, the spinal cord, the connective tissues, membranes, fascia around that as well. And almost everybody I see, there is that imbalance in the sympathetic parasympathetic nervous system, right? So we can look at the fight or flight response, or we can give it a million different names, right? Sympathetic tone, whatever we want to call it. But I think so much of what we're seeing, and it's not all of it, but the foundational piece is like that fight or flight response that people are in is contributing to a cascade of things. So it's like, how can we support people in their nervous systems? Because once again, if that's out of whack, sleep's going to be out of whack, digestion is going to be out of whack, hormones are going to be out of whack, or like everything rests upon having a nervous system that is regulated. So if it's not regulated and it's dysregulated, then disease will naturally follow, right? So even when I was doing more naturopathic stuff, I always put my hands on people from the craniosacral perspective, because there is so much benefit to understanding where the nervous system sits and helping shift some of those imbalances or like that hyperarousal state for people. And a lot of my work has been in concussion recovery as well. And people, when they've experienced a trauma, and, we can get into trauma and whether people interpret it, what is trauma. And it's not what you interpret consciously as trauma, it's what your nervous system interprets
Mm-hmm.
as trauma. And when that sits in the nervous system, people that think, like, even for myself, I thought I had a very regulated nervous system till about like 2 years ago when I realized, like, oh, for the first time I actually feel calm. And it's like, holy shit, how long have I been living like this? Right. And people don't realize, because it could even be like birth trauma stuff, or like we can go even further back. I think the main trend that I've been seeing, that's been a big one. And then of course it's like, depending where we are in the world, there'll be different things just based on like our food systems. And, but yeah, a big piece of it is, the stress piece, the gut piece. We always kind of look at the gut and the brain connection,
Mm-hmm.
because that's a major piece as well. So it's like they say all disease starts in the gut as well. So
Right.
those are really the foundational things that I look at, no matter who I'm working with. And then, it's kind of this pyramid. We always talk about this pyramid, right? And what's at the base of the pyramid of the foundational pieces. And then it's like, those nice fancy biohacking things are at the top, surgery, all those things. And it's like, but the foundational pieces are really what we need to have dialed in for the rest of the pyramid to actually like be able to work up it and to balance the rest. Yeah, I don't know if that answered your question fully of what I'm seeing, but
Yeah.
I think it's a lot of stress, nervous system. I think a
Yeah.
lot of people are looking for tools and support to help. Like you said, it's like, how do we work through stuff, right? And it's like, you and I are no stranger to like adversity or like going through the ups and downs in life. It's just we have a lot of tools and resources and people in our support system that we've built up to help navigate the changes and ebbs and flows of life, right? Because people
Yes.
often ask me, like, Brigitta, how do you do it? And it's like, I practice the things that I preach, and I always
Yeah.
did. That's how I got through naturopathic school, being a paramedic and working crazy hours. I don't recommend it, but I put my medicine into place, right? And it's like,
Mm-hmm.
it's the same thing. I have a lot of tools and resources that I utilize. It's not that, I'm always riding this high. It's like, there's moments, you're stuck in the shit. and you just let yourself cry and you let yourself be and process like the grief or whatever it is that's coming up, or that loss or that change that's about to happen. And when you actually go through it, then you can come out on the other side. But it's that avoidance piece often that like people are stuck in, right? And it's
Yes.
not because they're potentially purposely avoiding it, it's they may not have the tools.
Yes.
And I think that's the big one, right? So it's like,
Yeah.
I think if anything, yeah, finding whether it's the tools, the resources, or the people that will give you the tools and resources to help you through.
For sure. It's interesting with nervous system regulation as you talk about that, because that's something that I've been really working with within myself for a while now. And I didn't realize how stressed, even after removing the stressors,
Yes.
people are still stressed. And this is kind of what we're trying to say. Like, even if you leave that job, but if you've been in that job and it's not been a good situation for years and years, your nervous system is operating at that stressed or that fight and flight level. So you have to figure out ways, and supports in order to get yourself out of that. Even if you remove that stressor, if it's not healed at the root, the experience that you had, then your nervous system is still continuing to operate at that stress level, and you are more susceptible to disease. And like you said, we're seeing more and more. One question, autoimmune. How is your view on autoimmune? And do you feel that autoimmune is connected to, the stressors and that all of these things that are you go with it.
It's such a loaded question, right? Okay, so autoimmune and even things like fibro are such an interesting piece, because it's like, oh,
Fibromyalgia. You're talking
yes, fibromyalgia.
Yeah.
So how do I succinctly put this? So there's almost always like a nervous system component and a trauma that's in the nervous system. And also there could be like a physical, like even with fibromyalgia, like a physical compression that I often see in the dural tissues or the fascial system, or something that is creating a lot of the neurological sensations, right? Because it's not a very like pinpoint diagnosis, right? It's a diagnosis of exclusion. Or a lot of things can be, right? So, I mean, there's obviously like some autoimmune things, there could be everything from heavy metal toxicity, mold, Lyme, right? Like there could be a whole bunch of things that need to be addressed. And the nervous system also needs to be addressed, because there's some sort of imbalance from that chronic stressor that is then in the nervous system. So it's not an or situation, it's an and situation. Once again, having a whole bunch of tools is beautiful, because it's like you address it from a holistic standpoint, and you realize like we can treat the physical stuff, but we also need to treat the nervous system and the structural imbalances and all the pieces that come with it, right?
Right. And then the opportunity then to regain health through, food as medicine and herbal supports and all of those things. And that's also where naturopathic medicine and alternative practices to conventional medicine help. Not only are we getting you out of that disease state that you're in, we're teaching you now how to take care of yourself by showing you and having you experience what works in your body and doesn't work in your body, so that you can maintain that health moving forward. You don't need to come back for another pill, another prescription, another this, another that. Come back if you need us. However, that'll be when maybe your hormones are changing, or maybe, there's been a life circumstance that's happened. It's not, see you in 6 months, see you in 3 months, see you, that kind of thing.
Yeah. Yeah.
Okay, thank you. That's amazing. And I love that you have all this different training and experience that you draw on in order to you bring it all together really, really well. Thank you for explaining that.
You're welcome.
I really hope the way of the future is for natural medicine and allopathic medicine to begin to work collaboratively.
That's also my hope as well. And I think we're starting to see it, because a lot of, there's a big functional medicine movement happening, right? And some of those functional medicine practitioners are medical doctors, some of them might be chiropractors. So there's more and more other practitioners as well, obviously, but there's more of a shift towards looking at like, okay, how can we treat this a little bit more holistically? I think there's also a little bit of a trap there where like you spoke to green allopathy, right? And sometimes it's like replacing a pill for an ill with a supplement. And that's not what we want. We really want to get back to root cause. Nobody should be on 20 supplements. Like that's also a thing, right? So,
Right.
and actually there's some amazing medical doctors that you'll talk to and they will refer to naturopathic doctors for like gut issues because they're like, this is just not in our wheelhouse, right? And I think there's something beautiful about referring out and just really realizing our limits as practitioners. And we can't
Yes.
be everything to everyone and know all the things, right? Like we would like to.
Right.
But I think if we just know like when to refer or when to pull someone in on the team and to really help and support and really looking at it instead of competition as collaboration. Because our
Yes.
patient or our client at the end of the day, really if our goal is to help them get better, I don't
Yes.
really care how you do that. Like go see all the people that you want to go see. And you
Yeah.
know, if like whatever sings to your heart and you feel like that's what you need, go see those people, right? So my hope is that, you know, I mean, medicine has drawn on naturopathic medicine many, many times because pharmaceuticals obviously a lot of them come from botanicals to begin with, right? They're just extracts. So really, if we're kind of looking at the cyclical shifts that happen within medicine, it's like, you know, when it swings so far one way. And I think a lot of the patients also, they're kind of feeling a little bit stuck. And
Yeah.
now they're like, I've done all the things. Like I've gone to the specialists, I've done all the scans, I've done all the tests. I've done the things that I was supposed to do, yet I'm not feeling the difference. So it's like, you know, oftentimes we joke around in naturopathic medicine. It's like when there's no one else to go to, you're like, go see like the woo-woo practitioner because
Right.
they're like, we don't
Right.
know where else to go. Like maybe
Yes.
just try them. And you're like, okay, now it's been how many years? And like,
Uh-huh.
you know, then it's like managing expectations of like, okay, like it's not gonna be, you know, one visit 1 week to get you better, right? Like
Yeah.
it's been
Yeah.
ongoing for 10 years, so it's gonna take a little bit of time.
hmm
But I think, you know, a lot of people, it's almost like they need to explore all of those allopathic avenues and say, okay, I've done all the things, I've jumped all the hoops that I was expected to jump, yet I still don't have an answer and I'm not feeling any better. And that's when people, I think, start to explore. My hope is that people will start to explore before that. But, you know, that's kind of
Me
what we're
too.
seeing a little bit too. So,
Me too. Yeah. I think that the empowerment piece is really
mhm,
important, right? Empowering people with the information that they then get to decide what
yes.
avenue they want to take. But it's
Yeah.
hard when information is very limited or
hmm
even at times censored, that we don't have access to all the information that could be potentially opportunities and options for different ways to navigate our own health.
Yeah. There was actually a really beautiful, it was actually a medical doctor. And I think she was on TikTok, if I'm not mistaken. And she was just saying, she's like, listen, there's a lot more information now with social media. So with patients or clients, whatever it might be, they're getting a lot of information, right? We're in the age of information,
hmm
but really there's so much information, but it's applying it to you,
hmm
right? So now it's figuring out like what's actually going to work for you and where are you at and what do you need support with, right?
hmm
Because the thing is you can try a million things. Some things might help or be beneficial, and then some things you need a little bit more support with, or they need to be like tailored once again to you and your individual needs. So it's also shifting because people's eyes are being opened with like
hmm
access to so much information too
Yeah.
in that way, despite the
Yeah.
censorship that goes on some fronts. But I think it's a little bit more challenging. Like yes, there is censorship, but it's also like people are finding it in different ways.
Yes. Yeah.
And word of
Agreed.
mouth is travels as well, right? Where it's like, hey, I've gone to see this person, like they've
Yeah.
helped me, right?
Yeah.
Like I think a lot of my clients come to me as referrals. So that's always been my best source of like marketing
Yeah.
is
Me too.
referrals, which
Me
is the
too.
highest honor, right? Like
Of
to
course.
have be referred to. So
Yeah, and I
mm-hmm.
think I think sharing our experiences too, right? I mean, when we have
Mm-hmm.
an experience with a practitioner that is really positive and supportive and sharing that with friends and family and things like that, that's the way that we can get more people to become aware of, not only amazing individuals who are providing great support to people on the health and disease front, but just more information out there. I mean, it's like the telephone game, right? One person tells 10 more, tells 50 more, tells 500 more, and then all of a sudden you have a whole bunch of people that weren't even watching TikTok who
Yep.
who have all of this extra information now that perhaps they wouldn't have known if it weren't for that little whisper at the beginning of that person who, like you and I, sharing our stories. If it weren't for people sharing their stories too can keep things inside, but ultimately the hope is and the desire. And I think it's all about the intention. And I feel this was coming up for me while you were talking, because, we talked about interview a bunch of different practitioners, and I feel it's about the intention of the practitioner aligning with what it is that you're looking for. You might meet with somebody and it'll be like, yeah, I love this person. This person seems like we're right in alignment. And you don't have to make it fit. You need to find what is going to work for you, because the ease of connection is going to be very, very important as you become more and more vulnerable with your health. And the more vulnerable with your health and the more supported you can allow yourself to be, the better the practitioner can help you.
Yeah, you touch on a really, really good point there. It's about feeling safe, right? Because we need to be able to feel safe, to be vulnerable, to be able to like be supported and to actually heal. I can't tell you the amount of times like patients have walked into my office and they're like, I promised I wouldn't cry. And I'm like, it's such an honor when like people feel comfortable enough to burst into tears and just like let all of it go. And like, here it is. Holy smokes, it's amazing. It's like you've held a safe enough space for them to just, and that in and of itself is so healing to just have that space, right? So yeah, finding a practitioner you feel safe with is a massive part as well. So thank you for mentioning that as well.
Final question, Brigitta, is we've covered so much, and there's so much more that actually we could talk about, and we will talk about, because I already know I'd love to chat more with you. Final question is, any advice or wisdom or anything that you can kind of pass on to people from any perspective, people who are in a disease state right now, who are looking for answers, who are not finding them in conventional ways? What advice can you give them?
I feel the best piece of advice is to be open and to really like start going on first dates. It might feel weird or strange or whatever it is. And I think it's becoming less so, to be honest, but it might feel a little uncomfortable when you step outside of your comfort zone, but empower yourself and start to take those little steps. Go on the first date and see, like, could this practitioner potentially be for me? Maybe they have something to offer. Most of us have the internet at our hands. Like, start to look around and see, like, okay, I don't have to stop doing what I'm doing with my medical doctor, but are there other people that can support me? There's different circles and groups and workshops and things. So you can start to get taste and feelers of things to really see, like, do I like those practitioners? Do I like that modality? Is that something that maybe interests me, right? So I think just being open and being curious is the best way to be, because then you just let the universe, whoever we want to call it, like bring in the people that will support you the best. And sometimes it's like one practitioner will recommend another one, and then it becomes this beautiful spiral, right? Of like, before you know it, you have the whole team that you're looking for. So yeah, just stay open and stay curious, because the healing journey is messy and sloppy. It's not all like rainbows and butterflies. Once you move through it, it's good. And so we need support. I think that's the biggest piece, like figuring out like who's that team, but we have to be open first to like actually making that first step.
Yeah, that's great advice, Brigitta. I mean,
Yeah.
once you begin to kind of come out of the boxes that we've created or that society has created for us and we've chosen to go along with, there are so many different opportunities that can begin to present in life. And one of my favorite sayings is really, is if we are not uncomfortable, then we're not growing. So it's only through discomfort that we can grow. So one of my mantras for 2024 is really to try and put myself in a lot of uncomfortable situations. And it started with this podcast.
I love it.
And it's always interesting to see how the growth follows. So yeah, I love that. Be open and be uncomfortable. Okay, and how can people connect with you, Brigitta? Because I know that there are going to be many people who would love to potentially work in the energetics with you and working with cranio-sacral therapy. You have a lot to offer.
Thank you. Yeah, people can connect with me. I'm on Instagram at Naturally Neural, also at H2 Ohm in Toronto. So those are my physical practice locations, but I offer virtual energy work healing as well. So people can connect with me on social media. It's my biggest platform.
Okay. And I think it's important for people to understand that, as you begin to open up to different ways of perceiving things, you also begin to understand that just because Brigitta isn't going to be in the same room as you, or I'm not in the same room as you, doesn't mean we can't work miracles together. that ability to work interconnected is very, very powerful. And certainly we can't let distance anymore be a reason why we wouldn't connect with a person that we feel is the right person to connect with.
Totally. And, there's something to be said about in-person work, but I think there's so many amazing practitioners around the world. And if we've learned anything over the last couple of years, it's just being able to connect with amazing humans on other sides of the world to kind of support us along that journey can be a part of it as well. So
Yes.
yeah, like you said,
Yes.
just be open to things.
Amazing. Well, Brigitta, thank you again so much for all of your, sharing all your knowledge, your wisdom, your perspective. I know that so many people are going to learn so much, and that was exactly what I had hoped would happen and knew would happen when we arranged this conversation. So thank you so much for stepping up and for sharing, because I know that a lot of people are going to be thinking after our conversation today.
It's been an absolute joy, and I'm so proud of you for stepping out of your comfort zone and starting this amazing podcast. So I'm super excited. Thanks for having me.
Thank you, Brigitta. And we will definitely do this again soon because there's so many more things that we could chat about. Thanks for joining me today for Food Feels and Banana Peels. I hope you enjoyed the show and will tune in next week for a new guest, a new opportunity to learn and grow. It's an honor always to be a part of your journey. You can rate this podcast on Apple and Spotify, which will help it to be available to more people. Together, we can inspire people to make healthy changes and advocate for themselves in a different way. Knowledge is power, and I hope you'll share yours. Be well, and until next time. Together, we can inspire people to make healthy changes and advocate for themselves in a different way. Knowledge is power, and I hope you'll share yours. Be well, and until next time.